Good afternoon, everyone. We'll get started here in just a moment. Good afternoon, everyone. I'd like to welcome you. I'm going to run through a quick check before we get started. Nina, if you're there, if you can cam up and also unmute and make sure that your audio is good for everybody.
There I am.
Excellent. Okay, and so you fine. Meredith, if you can unmute as well.
Hey, Randy, I can barely hear you. It's a whisper.
Okay, I do apologize. And actually, if April, if you can give me a thumbs up, if the audio is coming through fine, I want to make sure Nina can hear the questions.
Yes, sir. I can hear you.
Okay. Meredith, are you able to hear me okay as well?
I can, Randy. Can you hear me?
I sure can. Excellent. All right. Well, we'll go ahead and get started since we have folks on the line. Welcome to our first COVID vaccine Q&A session, and this is for the general public of Rowan County. I'm Randy Kress. I'm Assistant County Manager and CIO. Nina, Meredith, I'll let you both introduce yourselves.
Okay, so again, Randy, I can barely hear you. It's like a whisper, so I'm going to do my best to, if I'm squinting, I'm going to do my best to hear what you're saying. But my name is Nina Oliver. I'm the Public Health Director for Rowan County Health Department. I have our nursing director on the phone. She's been instrumental in our COVID investigations and everything, basically everything COVID. She is here to assist me to answer any medical questions. So we are happy to be here and look forward to a good conversation today.
Thank you, Meredith. Would you like to do a quick intro?
I'm Meredith Littell, and like Nina said, I'm the nursing director here at Rowan County Health Department, and happy to be here and happy to answer questions.
Excellent. So Nina, I just want to make sure if you want to volume up on your phone as well, that might help just a little bit.
It's all the way up, Randy.
Okay, sorry about that. If you need, just ask me to repeat, but hopefully this will be more of a conversation from your side. So if you'd like, just tell us where we're at from the local health department in the COVID-19 pandemic and where we're starting to get with the vaccine process.
Yeah, so we are, for the last 9 months, we've been responding and investigating COVID cases. That is a very long, very tedious process that the nurses have to go through. Each investigation can take upwards of an hour and a half. They range depending on the information that each person that we speak to, the information that's given to us. And so for the last 9 months, we've been doing that. And we are now at the portion where we're going to start receiving vaccine. And this will be our, we've talked about tools in our toolbox in the past. So we've talked about using the 3 W's, the wait, wear, watch, wash. And now, so we had those 3 tools, and those were the only tools that we could use. That's all we've had. But now we have the big weapon, and the big weapon is our COVID vaccine, which we'll be getting fairly soon, Randy. And there are different phases to a pandemic, and I think that's probably what this question is geared towards. But I will share, in speaking with the state today, the state firmly believes that we have not seen the peak. Right now, we have our highest amount of numbers or cases we've ever seen. They do believe that the peak will be seen in February. So they are looking at all those types of trends, hospitalizations, percent positive, COVID-like illness, and we've got 2 very big holidays coming up, and that's Christmas and New Year's. And typically after gatherings or holidays, about 10 to 14 days later, we will see a surge of cases. So we will probably see that in January and into February.
Okay. Well, thank you for the current status. And as the vaccine is starting to become available, I've heard that there are phases to this vaccine as it relates to the prioritization. Can you tell everyone those phases, where we're at in that process from a Rowan County perspective?
Sure. So there is a prioritization, vaccine distribution prioritization framework that allows us let me start, Randy. The reason for that is because we will receive vaccine, but it's going to be limited. So in Rowan County, we have 142,000 residents. The vaccine is not able to be made that quickly. This is something that has to be distributed because it's a pandemic worldwide and then across our nation. So because we're not going to be able to receive the full amount for each Rowan County citizen, and that goes for all counties. There's 100 counties in North Carolina. What the state has done, along with other states, is they will distribute it based on a few factors, but one of them is county population. So what will happen is once the state receives an allocation and they send us our allotment of vaccine, we will get doses, and we have to prioritize those doses based on the highest need. So that's what this framework is all about. There are 4 phases: phase 1, phase 2, phase 3, and phase 4. And it looks like April's bringing those up for everyone to review. Phase 1 is broken down even further. So we've got phase 1A and phase 1B. So phase 1A is the population we will be focusing on first. This will be folks that are healthcare providers that work with positive COVID cases, healthcare providers that are vital or essential to the response and getting the vaccine out. This will be long-term care facilities and residents because they are at such high risk. So we've got that phase 1A, and then we've got phase 1B that contains a large portion of Rowan County, and phase 1B are mainly adults with 2 or more chronic conditions. So what that means is somebody that has cancer, COPD, obesity, heart disease, diabetes. So a large portion, because many of our citizens and residents have these types of high risk conditions, a large portion of Rowan County will fall into phase 1B, Randy.
Okay, well, no, and that's good. And I noticed you had worded that as this will start. So I'm guessing at this point, phase 1A and phase 1B, we haven't received anything. I know there's in the news, there's some locations that have received vaccines. So where is Rowan County in receiving vaccines to start 1A or then even 1B, and how do we find out that information of when we start and when we receive vaccines?
Sure. So some of the locations that have already received the vaccines are going to be, so the state started with hospitals first. And so they chose across the state 11 primary hospitals that had the ultra cold capabilities. A couple of the vaccine, in order to use the vaccine, they require ultra cold temperatures, and we're talking -60, -70, -80. So what the state did was they distributed first to those 11 hospitals that had that ultra cold capability. And then they distributed to the remaining, I think a total of 54 hospitals. Next will be public health departments. So we should very soon, we are expecting an allocation next week, Randy. We are looking at probably the Moderna vaccine. Which is good news for us because Moderna does not require those ultra cold temperatures. Pfizer requires that, and Moderna does not. So we don't have to deal with dry ice or making sure we have an ultra cold storage unit to place the Pfizer vaccine in. But I want to preface this. Things change so often, Randy. They change week to week and sometimes day to day. So the current information that we have received is our vaccine that we are receiving will be Moderna. That could change, but I believe that will be what we'll be getting. The FDA is reviewing the Moderna's efficacy and safety and effectiveness data this weekend. Once they approve it, the state has shared that they will ship that vaccine out to the counties. And that shipment should take place, or we should be receiving Monday, Tuesday, or Wednesday of next week. That is the potential date. Again, that vaccine that will be shipped out will be very limited. So we will be focusing, it will not be the general population. Once we receive that vaccine will be focused on the phase 1A only at that time.
Okay, so that was my clarifying question. So thank you for that ending note there. So this first supply that comes to the local health department will be for 1A, which will be for the healthcare workers. And so from what you were saying, the shipments that went to the hospital, that's for the hospital workers as well. Is that correct? So this is not for people that are in the hospital, or I guess where I want to make sure is, what do we know about when we get into, or do we have any dates of when we'll start receiving vaccines that'll start going to, whether that be 1B or any of our public, our citizens?
So there's 2 types of shipments. One's being made to the hospital system. And so what they'll do is they will start their process in vaccinating their employees. And then there's shipment to the health department. So public health departments are charged with providing vaccines to county residents, to county citizens. But again, we have to follow those phases. So we will start with phase 1A, and we will vaccinate our first responders, our essential workers, emergency management, paramedics, EMTs, public health nurses, folks of that stature that fall in those positions, dentists who have to do work that causes them to be at much higher risk at contracting the virus than others because of the type of work they do in people's mouths, things of that nature. So we are working right now to get a list together of, we're working with emergency management to get a list together of everyone that falls within phase 1A and phase 1B. Well, I'm sorry, phase 1A. Once we move to phase 1B, that is where you will see the point of dispensing site to open up. So, and let me just explain what the point of dispensing site is. A point of dispensing site, or a pod, is a place that's already been located in the county where citizens can go in order to receive a vaccine. So we are required by the state of Department of Public Health to exercise every 3 to 4 years our point of dispensing site, or our pods. We luckily, Rowan, exercised our point of dispensing site plan in November of 2019. What we did was we opened up the pod and acted like we were having a major influenza pandemic. So we had all our staff out there. We had emergency management, law enforcement, and we exercised how to get people through that point of dispensing site. It's very applicable to what is going on right now. Even though COVID is not a flu, we will be getting it out in that fashion. Most public health departments will open because we have to serve the masses of people. Most public health departments will vaccinate, will do a mass vaccination dispensing event or plan. Ours is at the West End Plaza. So we will work very closely with our media, the Salisbury Post, TV, and other outlets in order to get that information out to the public about when to go to the pod and who needs to go to the pod. Because again, we're still in phases. And
Nina,
that will go ahead.
If I can stop you there, just because as we open the pod, and I think you mentioned it, but just for clarification, that's at our West End Plaza location is what we've identified. Is that correct?
That is correct.
Right. Okay.
So, and we chose that, Randy, we chose that with the help of law enforcement. It's a very large space, which is excellent for the influx of people that we're going to have. But also it allows us to do a drive-through, which is has many benefits. Law enforcement is a proponent of this model here. It also allows people to stay in their car. It is more comfortable because we don't want citizens to be standing in lines for hours at a time. Some people can't do that. So people can sit in the comfort of their car. They don't have to get out. We will provide the vaccine while they're sitting there. It also protects people from the weather elements. If we have cold or rain, or, fingers crossed, we don't have snow, but it also will protect people from those elements too, Randy.
Okay, so in this phased approach, I noticed you had mentioned that we'll be putting out social media and we'll be working with the news media. And I know there's always going to be some confusion of individuals that are arriving and that may be in their car waiting. So will there be a screening process to determine eligibility so that you can move people that may have come too early, for like a 1B? And then, I know there's going to be media, but just trying to head off some of the natural occurrences of, hey, there's a lot of cars here, I'm going to get in line. How do you envision that process working? Because I know when we're going through phases, it won't be until the fourth phase where it's generally open to everyone. So is there a screening mechanism in addition to the media information?
Yeah, so that's a great question. So as you stated, when we start to move through the phases, we will be very clear and very detailed on who is included in that phase. So I'm looking at the information for phase B. So we will be very clear on folks that fall into phase B, and just looking at the framework, it would be homeless residents, healthcare workers not included in phase A, frontline workers, other adults with chronic conditions such as diabetes, obesity, heart disease, things of that nature. We will share that extensively with the media. We will make sure that is very clear. We will also will have a phone line, which we already have. We've had set up with your help. 9 months ago, we've got a COVID hotline and a COVID email address, which is monitored. The COVID hotline is monitored 24/7. The email address goes to multiple people. So we try to do our best to respond. So while we will give out very detailed information, if there's any questions or confusion, people are welcome to email and or call us. While at the pod, we will have people there to do a quick screening, but we really ask that people come on the honor system. It's a very difficult thing. If we have people that are coming into phase B and they should be in phase 4, we will do a quick screening, but we can't spend a lot of time. And that's why we really ask people to be on that honor system. So we can really focus on those that are at highest need. That is the point of the prioritization, is to focus on those that are highest need. So it's highest to lowest need. That's how that is how we would do that, Randy.
No, I really appreciate that, especially with opening up your hotline for that information. So as we hear about the dates and the times available, if there's any question, it sounds like just do a quick phone call. I know we do this with voting and election day for your poll sites.
Mm-hmm.
So I imagine this will be run very similar to make sure that you're using your time to the most of your advantage. So a couple of questions I had on what you're needing to prepare for when coming to a pod or a mass vaccination. Is this something that you're looking at and determining that you're eligible? Will you be called? Or how does that work? Just for the public to know on what you need to be watching for. Because I had seen some of the questions of, would I be notified that it's my turn?
Yeah, and that's so typically in a doctor's office, when you're going to see your provider I'll give you an example. I take the flu shot every year, and so do my children. And so when the pediatric doctor's office had the flu vaccine available for the children, they called me and said, "Hey, Miss Oliver, the flu shot is ready for your children. Let's make an appointment." So that is a perfect system on a very small scale. So now we are doing this on a very, very large scale. So we're looking at everyone in the county. So we will not be doing phone calls. What we'll be doing, and again, I'll stress, we will be using social media. We will be using our media, our TV channels, our newspaper, as widely as possible to say, hey, phase 1 or phase 1B or phase 2 is starting. These are the dates. These are the hours. These are the times that you need to come. These are the items you need to bring with you. And this is who is eligible. There is some eligibility based on health, but also based on age. So right now, Randy, the vaccines are available for those that are 16 and over. That could change, but at this time, at this time, it's 16 and over. And all of that information will be included in the media outlets that we utilize.
Well, and with that, I'd like to thank in our attendee list, I do notice that we have some media. So we appreciate you being on as well and being a partner in this to get the information out to the citizens. One thing that you didn't mention as you show up for this, is there any cost for the vaccine?
There is no cost. It is free to everyone. We want to make sure the government and the local county wants to make sure it is accessible to everyone that wants it. So it is free. I will also share that this vaccine is not a requirement. I know I have received several questions this week about the vaccine being required or that it's going to be forced to be taken. It is not. There's a small caveat with that, though, and I'll explain. So this is a volunteer vaccine, just like the flu shot. So I'm a proponent of annual flu shots. So that's what my family and I do every year. But others are not, and they choose not to take that flu vaccine. That is what this vaccine is. It is a volunteer vaccine. I will be receiving the vaccine, but others will choose not to. However, the small caveat is if you're employed by a certain employer and they require you to take the vaccine, that will be based on your employer and your HR policies and procedures. So I'll give you an example. There are some counties and there are some hospital systems that require you to take the flu vaccine. And if you need to, if you want to keep employment, you will take that vaccine and or provide them with a medical exemption. So that's the only caveat, Randy, with this vaccine is if your employer requires you to take it, then that will be up to your employer and your employer's HR policies and procedures.
No, thank you for that. I think that lets everyone know that if there is any question regarding, it being a requirement to check with HR, check with your employer, as they'll have the answers for that. That wouldn't be an answer that the local health department would have. So let's, before we go too much into detail on this, I know there's been a lot of discussion and a lot of media on the two vaccines times that are needed. So with the vaccine that Rowan County will be receiving, if we receive Moderna or if we receive Pfizer, are both of these requiring 2 appointments? What's the reason for that, if that's the case?
So both Pfizer and Moderna require 2 doses. It's a 2-dose vaccine. Pfizer requires you to return. So if you came yesterday or today for a Pfizer vaccine and we had it and we gave it to you, you would need to return in 21 days for your second dose. Moderna has a longer time span in between. That is a 28-day wait period. We will provide you with a reminder card and probably a reminder email follow-up. That's all being worked out in the system that we are going to be using. But there is a space in between. That space helps your immune system or your antibodies to kick in. We really stress that people come back for their second dose. While there is some data on the first dose giving you a little bit of immunity to the COVID vaccine, the second dose is really what does the full immunity that you are looking for. So it's important that when you get your first dose, that you come back on time for your second dose, Randy.
Thank you. And now we can get into some of the details, hearing that there are 2 doses. I know we're in a time we're seeing that those individuals that are COVID positive is high, are there any restrictions on receiving the vaccine? If you fall into the group, it's your time in the phases. If you've either just tested positive for COVID, or their timelines, if you're feeling symptoms of COVID, how does that work? Knowing that people are still, getting the COVID-19 virus.
Yeah, and that will be a screening that we would have to do. We would not recommend if you're sick, either with COVID or the flu or any a normal head cold that's so prevalent around this time. We would not recommend you getting the vaccine until you feel better, that those would have to be some screening questions. So a lot of times when you go into providers' offices now, or even into schools, they will ask you, have you been around anyone that's been positive? Are you showing any symptoms? Do you have a runny nose, cough, diarrhea, tightness in the chest? Those would be similar to some of the questions we will probably be asking. But we would ask the citizens to not come if they are feeling ill, and to come once they are feeling better, Randy.
No, thank you. And I'm receiving a few questions that are very specific to types and groups of individuals. I don't know that you'll have all that information
Sure.
here readily available, so I'm not going to ask them in their specifics. But I do want to go back to what has been stated, that, and I'll read through here about, are there certain parts of criteria, leukemia, different items. So as you get into those more nuances, how will that be determined? Because there's so many variables I know that can come with each of these phases. Again, I know you'd mentioned you can call or email as you walk through those, but have we received anything, whether it be from the federal or state, that kind of lays this out in a chart to help us, or what is our process there? Because I am seeing this quite a bit in the questions that's very specific. And again, I think we can answer those as those times become more clear. But
Are you asking specifically for the chronic conditions?
yes, there's some questions like, if you have leukemia, if you have allergies, what are the different pieces that put you into a category? There's one that just a general, what about teachers? So I'm seeing different questions and just trying to figure out the clarification. Will that just be very prevalent on the site to help you determine where you're at? Kind of like here's who I am, here's what my category is. And so I can easily categorize myself into a 1A, 2, 3, or 4.
Sure. So again, we kind of talked about, we would get there is a detailed list of those different types of chronic conditions and who should be fitting into phase 1B. So we would get very detailed with the media. Again, we will have that if someone has a question or is really just not certain, we have that hotline and that email address that people can utilize. And then we will do a little bit of a screening at the pod. But most of that will come out when we say, hey, we're ready to accept phase 1B. Here are the folks that we need to see. Here are the folks that need to come to the pod. These are the conditions that we're looking for, or that if you have, you're able to come to the pod at this time. We will get that information out. There is a list available.
Thank you. And so what we'll do for those that have asked the specific questions, if you'd like to have a direct answer back, and you can email that in. I know April's put the information there. I would also encourage you to send those emails in with those questions. It'll definitely help the health department understand some of the specifics and see where some of those questions might be, so that it can be answered for everyone. So that for those that have asked the very specific, I appreciate that. We'll take note of those and also put them into that. But if you can actually send that email, that way you get a response back. So thank you, Nina. So getting into you're through the process, what should individuals, I know we've gone through a pandemic exercise, people are going to be taking off work to get a vaccine, possibly. They're going to be in line. What should they be expecting? Is this a quick process? Or are they going to be in line for a couple hours? What do you anticipate there, just to give kind of folks an understanding of what this might look like?
Sure, and it's hard to answer. We working with emergency management and law enforcement, we have mapped out at the Westin Plaza about 5 lanes. We do have the capacity, if it's needed, to open it up to 8. So that does allow additional folks and will help with bottlenecking. I can't give an estimated amount of time for waiting, but we will do our best to get. No one likes to wait. I completely understand that. So we will do our best to get folks through the line. Also remember that while this is available to folks, this will go in phases, and not everyone in each phase is going to want to accept the vaccine. So that will cut down on a certain amount of people. But again, we will do our best, and we do have the ability to move our 5 lanes to 8 if it's necessary.
Okay, thank you. I do appreciate that. So you've gone through the process and you take the vaccine. Can you talk about known, immediate, impacts, reactions, how that'll be monitored, and then getting into, are there any long-term side effects from the vaccines that we've heard of? So first, focusing on, you're in line, you've received the vaccine. How do we handle that if there's a reaction, or is there not a chance for a reaction?
So I will share that the data has come back that the vaccine is very safe, and very few reactions. However, like with any vaccine, even the flu, there are some reactions. A lot of that, what they've seen is after the second dose, is they tend to see more within those that are 55 and older. And that is usually pain at the injection site, a warmth, redness, sometimes an achiness in the arm. Those are all normal. However, there has been a couple of documented cases where somebody, I've only heard of 2, has gone into shock. If that occurs, we will have, of course, on-site EMS and emergency management who will be there to assist with any health-related issues. But we will have a system where if you have a reaction either right there on the site or even after, so maybe the next day, you may have a reaction. There is a system where it can be reported to us, and we will report that reaction. And that's all things we're still trying. Well, let me back up. We currently do that for all vaccines. So if we give you a flu vaccine or any other vaccine, and you come to the health department and say in 3 days you have a reaction, that's something that you would call our immunization program and report that. So With COVID, it may or may not be a little bit different, and we're still working those finer details out.
No, thank you very much. That's very reassuring that you'll have folks on staff and on site for that. I do want there was a question, and just to see from a planning, because I know everybody's going through this process. When we're doing testing, inclement weather tends to cause cancellations. Do we see that there'll be the same type of cancellations for inclement weather if we go through the mass vaccination process at West End Plaza? Should folks expect it? Because I know they've seen that over the course of this 9 months.
Yeah, so with COVID testing, we have, like today, we canceled COVID testing because of the cold weather and the rain. We are working those details out with emergency management. We're going to do our best not to cancel vaccinations, especially since this is a time-based vaccine. And if your 21 days rolls around and it's snowing, we want to make sure you get that dose appropriately. But those are logistics that we have to work out with emergency management, probably use a tent system or something of that nature, where we could continue doing the work without canceling unless there's some major natural issue.
Thank you. I appreciate that follow-up, and I appreciate that question from the attendees on that as well. So getting back to the vaccine, just to help ease people's minds, and from what we heard, is taking the COVID vaccine, is there any chance that will infect me with COVID-19? Yeah,
so good question. So no, at one point, years ago, when we were doing vaccines, they used a live virus to inject into people's bodies, and they no longer use live virus. The virus is a killed or a dead virus, and that's what COVID is. So the vaccine will be injected. It will be dead virus. And what happens, Randy, it's really the human body is absolutely magnificent. It is amazing, and it does things that we take for granted and we don't realize it's occurring. But it's just a marvelous system. And what the body will do is, when you take your dose of vaccine, is your body will recognize that this killed virus is a foreign object. And what occurs at that moment is the body will stimulate its immune system and will send antibodies. Antibodies are like little soldiers, and they go and they fight this virus. So when you have the virus, the vaccine, the body will stimulate its immune system, will send antibodies, and those antibodies will fight against the virus. So what it does is, if you are exposed, so once you get your vaccine, if you're exposed to somebody that does have the virus, and that virus enters your body already has antibodies already made. So it can fight off the real virus or the alive virus, and you don't even know it. Or you could possibly have symptoms, become sick with the real virus, but your symptoms are much less than if you were infected without the vaccine in your system. So it does two things. It prevents you from getting sick, or if you do become sick, your symptoms are lessened. So a really amazing system, and that's why we do urge everyone to take the vaccine, especially those that are at higher risk with those chronic diseases, because that vaccine will help you fight off the COVID. If you have other chronic diseases, your immune system is already down or it's already compromised. So if you have COVID, if you are exposed to somebody with COVID, and you don't have the vaccine on board, your immune system is going to kick into overdrive to really fight off that virus, and may not have that strength at that time because it's already dealing with other conditions, and therefore you become very sick and can end up in the hospital. And unfortunately, that's why we've had tens of thousands of people pass away from it. So that's what we want to prevent.
Thank you, Nina. And I think that's a good time for this follow-up question that came in. Are there any specific medical conditions that individuals may have that would lean them toward not being recommended to receive the vaccine? I know you had mentioned just in some calls about pregnancy. Any other items that you're hearing of? And can you address the pregnancy as well? Because that's, a state that you're in for whom should not receive or not attempt to get the vaccine.
So I am going to actually pass that on to Meredith, our director of nursing. But I will share after reading an article, a quick article yesterday. So last week, or a couple of weeks ago, it was not indicated for pregnant women. There has been some information shared that it is safer for pregnant women, and the vaccine does not pass the barrier between mom and baby. However, that is something that each pregnant woman needs to have a conversation with their OBGYN or midwife or other provider, and to determine if that is what is best for herself and her baby at that time. But I will ask Randy if you could turn this over to Meredith real quick to see if she has any other feedback on this.
I actually do not, Nina.
Okay.
I was looking through some of the information I have specifically on Moderna, and I don't feel that we have been given that information yet as far as some of those criteria that are looked at, when saying maybe you shouldn't get the vaccine related to certain medical conditions. But if I could possibly have a little bit of time, I would be happy to circle back with Randy and get that information to him if I'm able to find it.
Yeah, Meredith, thank you. And just a quick clarification, because some of those that are on the call are, and this is on December 16th, Moderna has not been FDA approved yet. Is that correct? What is the next step that the Rowan County Health Department is waiting on to receive that vaccine, should it be approved?
Sure. So what we understand, Randy, is that it is looking to be assessed by the FDA on Saturday. If the FDA, what we are assuming based on the data and the efficacy studies, we are going to assume it's going to be approved, but that's going to be the FDA final decision. Once that decision has been made, and if it is approved, then that's when North Carolina will ship or distribute each county's allocations. And we should be looking at receiving our first allocation sometime next week, either Monday, Tuesday, or Wednesday of next week.
Okay, thank you. And I do have a follow-up question before I let you close it out, and then we'll open it up for Q&A. If you receive the COVID vaccine, is there still a need to wear your mask or follow the 3 Ws? If you can kind of go into that, and that can be after the first vaccine shot or after both.
Yeah, so it is still highly encouraged that you still follow the 3 Ws. Again, remember, while the vaccine provides is our ultimate weapon, right? And provides the most protection. It's not 100%. So in order to protect yourself and to protect your family and your loved ones, our tools are vaccination, wear your mask at all times around people that are not in your household, wash your hands, and social distance at least 6 feet. So those are our 4. We had 3 tools. We now have 3 tools and a weapon. So those are the 4 items we still ask everyone to follow.
Excellent. Thank you. Well, we do have a question, and it was one that I'm glad somebody asked because I was thinking about this as well. When we start the vaccine process and we're operating out of West End Plaza, we know that people will still be, contracting the COVID-19 virus. Are we still going to be doing testing? Is that going to be at a separate site, or is it going to be a combo if you have symptoms and you're in line? What are some of the logistics there of what testing looks like as we ramp up?
Sure. So we have been testing every day for many, many weeks now. We will not be able to do testing every day. We are in talks. I will be having a phone conversation with Novant this week. I'm also in talks with our federally qualified health centers, which offer testing. It will probably not be at the amount of testing that we've been doing 5 days a week, but they will be some testing offered within the county. Probably will occur on the health department site. We're still working on that logistics. That will occur on health department site and possibly other areas, but we will get that information out as we are doing right now. We do have testing schedules that go out, I believe, weekly, and we will continue providing that information along with vaccine information out to the public.
Excellent. Yes. And I do see that's posted on the site, and it goes out in the daily press release anytime there's any changes. And I know weekly, all the testing sites are listed within Rowan County. And if there's any associated fees or cost, depending on where you go, and then what I know like the VA is for veterans. There's certain, requirements in certain testing sites. So appreciate that. I'll open it up for question and answer. And as we may see some of those coming in, Nina, Meredith, are there any questions that may have not been asked that you want to make sure are covered just in what you're hearing, that you want the general public to be aware of as far as we understand the vaccine process at this point?
Not really a question, but a statement that this is a once in a lifetime situation. None of us has ever seen this. If you guys remember, the last major pandemic was in 1918. So over 100 years ago. So this is really a once in a lifetime situation. And it's something that that is very impactful. It is a worldwide situation. And as you hear in the news, there's lots of media and lots of news and things floating around on social media. It's really important that everyone receive their information from reliable sources. Sometimes we see on Facebook that this and this, or you get it from your cousin's best friend's uncle. While it's good to listen to family members, it's also very important that you get your news and your information from reliable sources. And a reliable source is the Centers for Disease Control and Prevention, the State Department of Public Health, your local health department and county websites, all excellent sources. Some of our media partners that are on right now really do a good job at accurately providing information for us. So those are reliable sources. And that's all, Randy.
No, thank you. And I didn't see any additional questions come in. I'll take that as a very good sign, I hope, that we've answered a lot of the initial concerns and questions and just general things that individuals want to know. I know there's a lot of new information that'll be coming out as we start moving into these phases. Again, from Rowan County's perspective, we haven't started phase 1A. It sounds like, the earliest that'll be is next week. So we had intended on doing another session in January. I think we'll talk after this, determine the best time, and probably mid to late next week, probably get that date out as we'll know more from both the state and how that impact is for the distribution. But and Nina, Meredith, would you be open? I know we're going to schedule this, but if we find that there's a rapid pace to this, I know there's Operation Warp Speed that's pushing this along very quickly. It sounds like, we may have to give a, 1 week notice and might have to have another session for everybody. So if you both are open to that, we'll tackle that as we go through this process. Again, like you said, it's new for everybody. I really want to thank everybody that's on the line. Again, this is the first of these. We'll have another scheduled in January. And again, if anything comes up, we might have one before the end of the year. Any closing comments from either of you? I really appreciate both of you taking the time and all of the work you're doing as we move into the next phase of this pandemic process.
No, we appreciate all the questions. I think no question, and sometimes people feel that it's a dumb question. No question is dumb. We are learning with you, and we are here. That's part of our job, is to educate and provide you with information. We continue to strive to communicate and be as transparent as possible. And that is our job as public health, is to serve our Rowan County public and to make sure everyone is safe and healthy. And that's what we're trying to do our best. So thank you. I want to thank you, Randy, for being our host, and we look forward to the next one.
Excellent. And I think there was one question, and the answer to that about where it will be posted. We are recording this. We'll have the live content, put out there in a recording format. We'll have, and this will be on our COVID-19 page, and we'll also have links that the media can use to direct link to. One quick, as we go, in a very important population is the county working to ensure the homeless population will receive the vaccine? And I know they're in one of the phases as well. So
we are.
Excellent. And more information on that'll come as we go through those phases. So
absolutely.
Nina, Meredith, I really appreciate both of you and your staff and everything you're doing. I know we have our next challenge ahead of us, and we appreciate all of the community with your questions as well as we go through this. So everyone have a great rest of your day, and thank you.
Wonderful. Thank you. Bye-bye.
Thank you.